Hello, my name is Maxwell Chiazo. My presentation today is about a book I reviewed for the course Social and Cultural Perspective for Health. The book I reviewed is titled "Is Inequality Bad for Our Health?" The authors are Bruce Kennedy, Norman Daniels, and Ichiro Kawachi. The book was published in the year 2000. The central theme of the book is about inequality, inequality of social economic opportunities, and how it affects public health outcomes. The authors basically stated that the U.S. system of healthcare does not favor equality in every form. And they felt that was that is a very big public health issue, and there should be more debates about it. The report is basically on many years of empirical research work that has been carried out by experts over the years, looking at data about healthcare across the different spectrums of the United States population. They talked about social justice. Social justice, in the fact that they believe that social justice is about fairness. Now, which is basically based on the work of a famous philosopher called John Rawls. John Rawls talked about justice, and that justice, in a way, creates a kind of equality in society. And they used the John Rawls position to advance for similar system for the American healthcare system. They talked about social and economic condition or socio-economic determinants of health, and they believe that those determinants, which are basically about employment, housing, and access to healthcare, needs to be improved. But for that to be improved, there need to be a form of changes in the level of income distribution, the issue of housing, and the issue of workplace engagement. There were many other supporters of this argument. Michael Marmot talked about how inequality in a country tend to undermine the overall potentials or full potentials of the country's economic advancement. He cited many examples which I cannot actually read out here, but again they were also contending, there were also people on the opposite side who argued that inequality, there's no, who question whether inequality is different from poverty. And they said, and they also argued, is inequality really important? That what they thought was important is access to health care, to good health care. They also talked about the difference in the political system, which tend to affect how healthcare is delivered in the US. Most of those arguments centered on the fact that the political system does not favor the type of system that Bruce Kennedy, Norman Daniels, and Ichiro Kawachi are actually proposing. Ichiro and Kawachi solution for actually overcoming these problems of inequality is to have early childhood education intervention, intervention in nutrition, intervention in work conditions for minorities and other people at the bottom of the population, economic status, and again, a form of income redistribution. Most of the opponents do not favor that because they don't think that income distribution or redistribution is actually relevant as U.S. government is U.S. society currently operates. But overall, there was a consensus that access to good health is very important, and a form of improvement in income level will help to mitigate against the high level of inequality in the U.S. They also talked about good access, provision of good access to health care, that if that access or that window is actually strengthened, that it will make a case for for a better society. For me personally, I do not think income redistribution is actually important, especially in this case, because income redistribution either way does not actually make, will not take away inequality. So what needs to be done from my own perspective is that the healthcare, there has to be better ways of income, better way of reducing inequality, of reforming the healthcare system so that those at the bottom can still have good access without actually affecting the overall population. Thank you.